Hey there, I'm Jason, and this is Stress Out, the show that's all about everyday stresses in life and how they affect us. We'll look at some of the typical ways one might seek treatment, and then some of the alternatives. Now, I want to get this show on the road, but where is this woman? Weren't my instructions obvious enough?
Jason! Don't go away from me!
Why do you always have to be late? Roz? Roz?
Jason, wait! Jason! Jason, where are you?
Roz, come on, where are you?
Gotcha! Finally!
Where have you been? You're late.
Been running around after you. I can't open my mouth.
Talked too much yesterday, right?
My face hurts here.
Tripped over your tongue? Fell on your face? All right, off to the dentist with you.
Wait, I need to rest first. Run around after you, very tiring, you know.
What, you think we have all day, is it? Come on.
Doctor, this morning I woke up and I couldn't open my mouth and this side of my face hurt.
Have you ever had locked jaw in the past, or does your jaw make clicking sounds when you open your mouth?
Clicking but not like a locked jaw.
All right, let me take a look. Over here?
Yeah, the right side hurts.
All right, and what about this one?
Here also.
Okay, now can you just open your mouth? Very good. Now it looks like you have a locked jaw on the right side.
So, why do people get locked jaw?
Now this is a picture of the upper jaw and the lower jaw, and this is the jaw joint with the disc in between. Now, during normal mouth opening, the jaw will rotate and then it will translate to a forward position. But in your joint, the disc is dislocated out of position. So when you try to open your mouth, the jaw can still rotate, but it has difficulty translate, which is why you cannot open your mouth.
Why do people get that?
Now, locked jaw can occur as a result of trauma, injury to the face or the jaw, and it can also be associated with clenching and grinding activities.
What sort of people clench and grind their teeth?
Now, clenching and grinding activities is an involuntary movement performed by the jaw, and it occurs usually at night time. Now, a lot of people clench and grind their teeth in the daytime too, and many people do not have any symptoms of jaw pain or soreness in the jaw. Now, it can be stress-related.
What sort of problems does clenching and grinding cause?
Clenching and grinding can cause the teeth to wear, and this can result in sensitivity of the teeth. It can also cause teeth to fracture. Now, some people clench and grind and they get headaches, earaches, and face pain along with that.
Doctor, so how do I free myself of this locked jaw?
I'm gonna help you do that.
So, we know that Roz is a night clencher because of the pain that she experiences in the morning. And because of the clicking, we also know that she has some TMJ or temporomandibular joint problems. Dr. Lim's just going to measure the range of movement that she has in her jaw.
Okay, that's good. Now, I'm gonna need you to move your lower jaw to that side. Do it all the way, and then very slowly open O. Good.
I feel so much better now. So, am I done? Are we good to go?
No, we have to make a splint for your teeth.
What's a splint?
Now, let me show you what a splint is. This is a splint. It fits over the upper teeth, and it's supposed to be worn mainly at night time. Now, a splint helps to reduce the forces of clenching and grinding so that the jaw pressure in the jaw joint will be reduced as well.
Okay, I'm gonna get my splint done now. I'm gonna get my impression done, and we're gonna put a mold inside my mouth so that it follows the shape of my teeth.
Okay, now let's relax your lips. Okay, and just open a little bit. Good. Is that the weight? Okay. Just gonna pull a little bit up. Good.
Oh,
Well, someone has to wear a splint at night. Isn't that like a reverse denture?
yes, Jason. Stop being irritating.
Hey, stop stressing. I can see you clenching already.
That's cause you cause me so much aggravation.
Well, one of the ways that you can manage a temporomandibular joint dysfunction is to be aware of some of the stresses that cause grinding and clenching. A huge project, for example,
Or annoying colleagues.
or colleagues that get annoyed easily. But once you're aware, you can put into place mental checks to stop yourself from grinding and clenching your teeth. So you basically have to say to yourself, I'm clenching, stop it.
But of course, this is possible only in the daytime.
Yeah. At nighttime, it's a bit hard to control, so that's why you have to wear a splint.
But wearing a splint might not be the most attractive solution to some, so what do you suggest?
Well, maybe we can find a solution at the chiropractor's.
Okay.
Let's have a look. Dr. Stakes, what does chiropractic mean and how does it work?
Chiropractic means done by hand, and it started over 100 years ago. And basically what we do, the chiropractor works with his hands to correct the alignment of the spine, adjust all the joints in the body, including the TMJ, as well as the knee, hip, and any other joints that may be not functioning properly.
Can chiropractic treatments be used to treat specific disorders like TMJ dysfunction?
Well, most definitely. Usually problems in the body and joints particularly start when there's been lack of mobility. And a chiropractor's job, simply put, is to restore the motion to the joints and thereby restore normal function, in which case healing can occur in the body as well.
Roz had a locked jaw this morning and the dentist relocated her jaw back into position. But how would you go about treating a TMJ dysfunction like hers?
Basically, we'd have to start with the examination and see what the problem is, and thereby try and isolate which joint is being affected. Let's move across and see. Okay, Roz, while you're here, could you just open your mouth as wide as possible? Okay, can you fit?
Bit sore.
Right. How many knuckles can you get in there? 1 or 2? Okay. 2. Okay, you should normally be able to get 3 comfortably, so there's a bit of a restriction there. All right, and it's on the right side. Can you open as far as possible and then wiggle left and right? Left and right. Ouch. Okay. There's not much movement. What we do is we measure from the teeth and we watch how far across she moves to the left or the right. Usually there should be about 8 millimeters movement to either side and it should be equal. In her case, there's not much, so it's still a bit stuck. There's some muscular stiffness inside there. Right, so we're going to move on now, and I'm going to palpate your inner ear as well as inside the jaw and get a feel of the movement.
Dr. Stakes is feeling for pain and tension around the muscles of the ear, chin, and in and around the jaw. This will help him to focus his treatment and settle Roz's TMJ dysfunction. I believe in your practice you integrate exercise into your treatments as well. Can you show us some of the exercises Roz can do at home?
Basically, you hook your index finger underneath the front row of teeth, and then you pull down and then open to the opposite side. Using her resistance here, she then pushes the jaw out to the side. So you're kind of doing this. At the initial stage, we suggest applying ice to bring down the inflammation as a home activity. There's also some topical glucosamine creams that you can apply that we have to use with MSM and Boswellia, which really help with the pain and inflammation. Other things you can do is apply, after the initial stage, apply heat and then continue with the stretching exercises.
Coming up, we test Roz's threshold for pain and we find out what other people do to relieve a pain in the jaw.
Jason, I feel so much better now. The tension is kind of gone and it's not as painful anymore.
That's the problem with pain. It's not very quantifiable. Some people can tolerate pain really well, and others will just look at a needle and feel pain.
No.
Yes, I'm talking about acupuncture.
I hate you.
But it's really good for TMJ pain. Come back. Roz has just finished a consultation with Dr. B, an acupuncturist, who has confirmed that she does have a TMJ problem. Dr. B, what is acupuncture and how does it actually work?
Acupuncture is an external therapy with a fine needle to prevent and treat diseases.
What do you actually put the needles into and what does that do?
We put the needle into the acupoint. This is the special point. It's connected with the meridian to stimulate the qi flow and the blood circulation.
For me, I have this TMJ problem. How can I use acupuncture to cure it?
TMJ problem, we can use the acupuncture technique, can combine with the Chinese prescriptions. Also, if necessary, we use moxibustion.
So, Roz, are you ready for your acupuncture?
Nope.
I got a feeling you're going to get it anyway.
Is it gonna be painful?
It's a bearable, it's like an bite.
I had an ant bite before. It wasn't very bearable.
After we put this needle in, so you may feel better around this area.
Okay.
More relaxed and won't be so tight. So one more acupoint is here. We call Xiaguan. This also is another crucial point for treat this TMJ disorder syndrome.
So sometimes you would put a needle in there as well?
Yeah, if necessary. Okay, the needle remain here for 20 minutes ready. We're going to remove it now. So just relax, huh? Are you okay?
Yeah, that was okay.
That wasn't too bad for me. Well, Roz, I thought you were pretty brave at the acupuncture clinic with the needles sticking into your hand and everything.
Well, Jason, actually, it wasn't that bad. But let's go find out what other people do when they get jaw problems.
Okay.
Stressful, right? So you want to
Relieve it.
relieve it. Just count 1 to 10.
Most likely we'll ask them to visit a doctor or something like that so that we can solve their problems. Try to massage it. You just keep massaging your mouth. Pluck out the teeth.
Have you eat something you like before sleep?
Probably just do something relaxing.
Just relax, I think.
I think music also tends to relax yourself. Or walk in the parks, work together.
Get someone to make the person laugh. See the dentist. Look for medical treatment.
Meditation,
Relaxation.
or maybe a rubber chew toy.
Massage therapy, probably.
I think we should get stress balls. I need quite a traditional method where people say use a spoon. That's a very Asian method.
Well, we've asked around, and it looks like a lot of people have different ways to deal with the TMJ problem.
But not that many people actually suffer from it. I think it's all that talking, Roz.
What? I don't talk that much. Seriously, Jason, where are you going? We are having a conversation. You can't just walk off like that, you know?
When we come back, Roz tries out craniosacral therapy, and we find out what kinds of food are good for locked jaw.
Okay, Jason. How long are you going to keep me waiting? Tell me more about this craniosacral therapy. Any needles involved?
None at all.
Oh, good. Do go on.
Well, craniosacral actually comes from two words. Cranium, meaning the skull, and sacrum, meaning the lower spine. It actually originates from osteopathy, which is a study of the musculoskeletal system. And, well, after that it gets kind of complicated, so we should ask someone who really knows.
Okay.
So Adita, what is craniosacral therapy?
It's a gentle, hands-on therapy that evaluates and enhances the flow of the craniosacral system. But basically, it comprises of the bone in the head, the sacrum, the spine. So we look into the whole body system, the head, the spinal cord, central nervous system, the sacrum. So as a therapist, I'm trained to palpate and listen with my hands the flow of the cerebrospinal fluid in the craniosacral system.
What are your hands actually palpating for?
It has a rhythm of 6 to 12 cycles a minute. So we actually palpate and listen to the rhythm, the rate, and quality and amplitude of the flow of the cerebrospinal fluid in the whole system.
And how do you use it to treat specific problems or symptoms?
So when a body's craniosacral system is dysfunction, the functions of the brain, the spinal cord, and the central nervous system becomes compromised. So any body parts that are influenced by the brain, the spinal cord, and the central nervous systems becomes affected.
Well, that's craniosacral therapy for you. The only thing left to do now is to try it out.
Just lie back and breathe deep, Roz. By just placing her hands over parts of the body, Adita is evaluating Roz's craniosacral rhythm. Adita can also feel the tension in Roz's neck and shoulder. No surprise there. Oh no, the gloved hands. Adita gently presses on the muscles inside the cheek and near the jaw, assessing her TMJ dysfunction. Okay, Roz, you've had your jaw clicked, rotated, manipulated, pushed and pulled into great condition. Your TMJ must be really oiled up. Are you ready to swing into action?
You bet. I haven't had a bite to eat all day. Let's go get some food.
Okay, here we are back in the kitchen, and here are some food facts for you. If you're having TMJ problem, don't aggravate your problem by eating hard foods.
That's right. Go soft on foods. Up on the porridge and down on the crunchy biscuits. But if you like foods like apples, make sure you cut them up into little pieces.
Remember to take small bites.
That means no triple-deck burgers or anything layered that requires mouth gymnastics.
Ultimately, a happy joint is one that comprises of happy bones, muscles, and ligaments.
That means you need plenty of calcium-rich foods like yogurt, cheese, and milk.
And don't forget protein-rich foods like soybean and tofu.
Plenty of soft options. Anyway, we have some tofu in the steamer. Should be about ready.
Looks good, smells good.
Just pop it out and drain off the water.
Oh, it looks really good.
It's beautiful. Here we go.
After you steam the tofu, everything is as you like it. You can add dark soy sauce, light soy sauce, dark sesame oil. You can also garnish it with parsley, a little bit of parsley, spring onions, fried shallots, and toasted sesame seeds. There you go. And this is my favorite part.
Hey, what are you doing?
I'm adding chili flakes and seasoned pepper.
I didn't know you like it spicy.
When you're around Jason, only my food.
It was interesting to watch the different therapists today worked on the same problem. The dentist and the chiropractor, for example, worked specifically on the TMJ, whilst the craniosacral therapist and the acupuncturist worked on other areas of the body. Roz, are you going to finish all that?
Well, I figured since I'm the one with the TMJ problem, and you still have to watch out for your love handles, I should have it all.
Should have left you with lockjaw.
Hey, Jason, you still have the show to finish up. Why don't you do that while I finish this up?
Well, why don't you finish it so I can get some of this into me?
Jason, I already did episode 1, and you fell asleep in episode 2. Do your job.
This is good. All right. This is Roz, and I'm Jason. Come back next week for another episode of Stressed Out.
Move away. Step back.
I just want to get my
again.